So this video is going to cover an instrument tie, essentially what we would traditionally use in urgent care or emergency medicine to secure a laceration back together. So for the purposes of doing an instrument tie, as you're throwing the suture, you always want to remember that you want to get as many sutures, many stitches I should say, out of any suture material that is possible. So for that reason, as you're pulling and using the needle driver to essentially push the suture material through the patient, if we were to back up and essentially grab the suture material, this would represent my needle, and if I'm pulling that through the layers of the patient and pulling it out the other end, then I want to ensure that I have all of this material left to be able to sew that patient back together. So for that reason, you want to ensure that the tail is relatively short. So this is demonstrating with your right hand, although you should be familiar with how to do it with both hands. So here is your needle driver. And what you're going to do is take your suture, take your string at this point, and you're going to wrap it around your needle driver. And you're going to do that twice because, again, we are creating that surgeon's knot. So we wrap away from us and away from us. You're going to grab that distal aspect, and of course, because this is yarn, it's not going to glide through as suture would, so just kind of help it through. And you're going to pull what would be the purple end of your string to go superiorly and the white part to go inferiorly. Again, creating that surgeon's knot because you threw the string around the needle driver twice. And now we're going to continue on as if we were doing a two-handed tie, except our other hand is our needle driver. So just place your needle driver and just wrap the string towards you and go down and pick up your string and pull it through. You won't have to help anything when you actually have suture material. It'll glide right through. White goes north. Again, now your purple in theory would be moving south. Now because we went toward us that last time, we've now created our first square knot. We're going to take the needle driver and wrap the string away from us. Go down, pick up your end, pull it through. White south, inferiorly, purple superiorly. Needle driver, wrap towards you. Go down, pick up the end of your string, pull it through. White is going to go superiorly, and the purple would then move inferiorly. You would complete this another time to ensure that you had 3 complete square knots, so you would have 6 hitches. Let's go back, and I'm going to untie this here just for a moment, and let's review that first hitch that we throw. Again, that is going to be your surgeon's knot, and how we do that when we have an instrument tie. Needle driver, suture material, short end on the distal aspect of the patient, because you'll learn with sewing that you're always going to pull that needle towards you. You always want to sew towards you. So again, we're going to wrap around twice, once and a second time. Go to the distal aspect, grab the white. With this string, you're going to have to kind of help it along. But again, the short end will be coming then toward you inferiorly. The longer strand would be pulling away superiorly. Release, and now we've created, again, that surgeon's knot, just that first throw. Here's your needle driver, wrap towards you, go down, pick up the string, and pull it away from you. As it's now away from you, wrap away from you, go down, pick up the string, pull towards you, and since your short end is now towards you, wrap toward you, go down, pick up the string, and pull and wrap away. And again, you would complete this 6 times total for a sum of 3 square knots. 6 hitches equals 3 square knots.